Hey there, it's Dr. Jim Collins. Thank you so much for stopping by. This week I'd like to talk about a serious topic, one that I've been looking into for quite some time and trying to help a lot of individuals deal with this particular problem. My topic this week is depressed healthcare professionals, a serious and growing problem. And you may know something about this yourself. Maybe you are a healthcare professional dealing with some emotional issues. Perhaps you have a friend or a colleague or know a healthcare professional that is dealing with particular issues right now. Healthcare professionals like doctors, nurses, social workers, nursing assistants, the whole gambit, they're human and they experience everything that anybody else would experience. Things like depression, burnout, even thinking about suicide, unfortunately committing suicide. So they're just as vulnerable. But according to what the literature is saying, they might be more vulnerable to feelings like sadness, despair, a loss of self-esteem, and they can suffer if they're dealing with depression. They might also be dealing with concentration problems, focusing on the job at hand and the patients and their needs, medications. There's a lot to think about. So one of the most important differences, though, between healthcare professionals and everybody else is that healthcare professionals are taking care of other people. Quality of care, patient safety, things like that might become compromised when depression is present, and that can be a big, big problem. So the dangers of depression in healthcare professionals, let's talk about that for a moment and see what I have found. I don't want to paint a picture, first of all, that every healthcare professional is depressed. And if they are, that they're putting anybody at risk, because that's not the case whatsoever. Okay. They're not all putting patients, clients, or elderly residents in senior care in danger. Everybody's different. Everyone has different coping skills and styles, and every one of us will experience symptoms differently, okay? They'll also range in their coping abilities and their coping skills to handle negative problems, emotions, anxiety, things like that come along. That being said, in the literature, in the research, there's a clear link between medical errors and mistakes that do occur due to the symptoms of depression, burnout, and other emotional conditions. Thankfully, and this is a big takeaway, the medical community is now taking a very serious look, a deeper look into this issue. Healthcare today is not what it was 30, 40 years ago. It's probably even more stressful now. It can take a heavy emotional toll, even on the best of us. This has nothing to do with character flaw or weakness. This is the nature of healthcare, so to speak. Some studies do show that depression and medical errors have a positive relationship, and as the professional becomes more depressed, more burned out, the number of errors increase. So I'd like you to check out my article on this topic, Depressed Healthcare Professionals, a Serious and Growing Problem, because I do write a little bit more, give you some details, and I also get into what healthcare professionals do about their depression. And until next time, my name is Dr. Jim. Take great care of yourself.